Are we recording now, Alice?
Yeah, we're now recording.
Yeah, excellent. The other thing we will be doing at the end of the presentation will be using the mentor meter to just ask a couple of questions, give us some immediate feedback at the end of the session. So what I'll do now is hand over to Sandra and we can start the session.
Great, thank you very much, Kathy. Okay. Start with a little bit of context, and I know that most people on the webinar here today work in Birmingham, but I think it's always worth just reminding ourselves about sometimes the scale of the challenge and the context that we're working in. So of course, Birmingham, a huge city, you know, the second city in the country, but we do have a large population, about 1.1 million people. It's often said, but it's also worth reminding ourselves about, yes, we are a large city, but we're also quite a deprived city. So if you look at the deprivation indices, that we have about 56% of our population live in the 10% of the deprived wards in England, in areas. So actually we're a large city, we're a deprived city, and actually we're a very young city as well. If you look, 46% of our residents are aged under 30, and because we're a young city, that also means that we also produce lots of babies as well, because young people tend to be the ones having babies. So we have about 17,500 live births every year. And if we look at the population of young children, especially the 0 to 3-year-old group, we have 68,000 people. So a large, deprived, young city, lots of children, lots of young families around. The other feature we want to just mention, of course, is that when we think about childhood health, one of the key measures that we are looking at is about childhood obesity. And of course, we use the data from the NCMP. Now, what they've done here is actually, this is national, this isn't just for Birmingham, is actually look at the data of children who are obese. So this is just obese children, it's not overweight children. And we can see that where we have deprivation, it sort of exacerbates the level of obesity. So if we look on the left-hand side there, we have reception class children. So they're the 4 to 5-year-old group that actually we have in the most deprived areas in England, we have more childhood obesity. And if we think back, Birmingham has a lot of deprived areas. And by the time we get to year 6, we have that big increase. And this deprivation gap is widening. This is the data from 2018 to 19. If we looked at the data from 2 or 3 years before that, whilst there will still be a deprivation gap, actually we've seen that the gap is widening. There is a slight gender imbalance in terms of more shown at year 6 than in reception class, and there is some ethnicity variations, but actually it's not quite clear cut, and so we haven't presented that here. What I just want to dwell on a minute is this slide here, which I think is particularly interesting. So what they did was they tracked children, because the NCMP has been running for a number of years now, is that because each NCMP is a cross-section, and we don't tend to follow children, what they did was they looked at 34,000 children whose data we had for reception, and those same children, what was their weight status like at year 6? So they have actually tracked these children. Now, this was done in 4 local authorities, but one of the local authorities it was done with is Birmingham. So we know that Birmingham's data is part of these are our children. And you can have a look at it, but actually what it sort of says in essence is, if you look on the right-hand side, which is the weight status in year 6, basically to be a healthy weight at year 6, you pretty much had to be a healthy weight at reception. So if you enter reception class and you're not at a healthy weight, your chances of being a healthy weight at year 6 are pretty small. So what that's saying is that your weight state, in order to be a healthy weight at year 6, you had to be a healthy weight at reception, which actually means that the work that we do preschool in early years starts to be increasingly important, because actually we need to make sure that children are that are a healthy weight when they enter into reception class. When we think about areas of the city and about weight here, this is the latest data from 2019-20. So the areas shaded in green, we have children who are healthy weight. The reception is on the left, year 6 is on the right. The areas in yellow are where children are overweight, and the areas in red are where children are obese. And you can see that, you know, we have more children obese when we start to get to year 6, but also, you know, those of you and us who do a lot of data and look at maps, actually what you're really looking at, particularly when we're looking at the year 6 data, is we're looking at a map of deprivation, aren't we? We can see that where the deprivation, the poverty indices start kicking in there. So we wanted to talk more about the early years, and particularly what we wanted to talk about was the Healthy Start scheme. Now, the Healthy Start scheme, which I'm sure many of you know about, but it's also worth just talking about some of the basics, actually comprises of 2 key elements. So there is the vitamins, there's the Healthy Start vitamins, which Kathy will talk about in a minute, but there is also the food vouchers scheme there. So the eligibility for the Healthy Start scheme actually is here. So you are eligible to be registered and receive the benefits of the Healthy Start scheme, so the food vouchers and the vitamin vouchers, if you meet one of these 3 criteria. So if you're under 18 years old and you're pregnant, it doesn't matter about your benefit status, it doesn't matter about your income status, you're eligible for the Healthy Start scheme. If you're pregnant and over 18, then you need to be eligible for benefits. And then it's also that post-pregnancy for children aged under 4, the parent or the carer of those children is able to be part of the Healthy Start scheme, but the eligibility will depend upon certain benefits. So the benefits that entitle you to be part of the Healthy Start scheme are these. So they're fairly classic ones that you can see. The one that's maybe slightly different there is about pension credit. You think, but actually it's about carers. So you could have grandparents or people who are eligible for pension credit who are also looking after the carers for the grandchildren, in which case they are also eligible for the Healthy Start scheme. Now, lots of people here work with nursery age children and maybe preschool. So actually, if we're thinking about, okay, what does this actually mean? It's the same eligibility for families that are entitled to free school meals, or that the free the free entitlement to early education. So the 2-year-old early education entitlement is also, so it's the criteria. So if you know that families are eligible for that 2-year-old early education entitlement, ask them the question, are you also getting your Healthy Start vouchers? Because it's the same criteria. And whilst the children attend in school, so, you know, they're 4 or 5 years old, they're in reception class, they're too old to be part of the Healthy Start scheme. If they've got younger siblings, then actually they are entitled to be part of the Healthy Start scheme. So actually, if you think about how, bearing in mind about the eligibility, it's the same criteria for those. If we think about with the food vouchers, what it actually entitles you to are these types of food. So the formula milk is the stage 1 milk. So it's the milk that you're eligible, that's suitable for babies post-birth. You're not allowed to use the Healthy Start vouchers for any of the follow-on milks. It's actually for that first stage formula milk. It's eligible for all versions of cow's milk. It doesn't apply to soya milk or other cow's milk substitutes. It's about cow's milk at the moment. So any type of the cow's milk. With the fruit, it can be all types of fresh fruit and all types of frozen. The same with vegetables, all types of fresh vegetables and frozen vegetables. And it also, which is not always so clear, is about fresh potatoes, okay? The change that happened last October, which isn't as well known as possibly it should be, is actually they expanded the range of foods that you can now buy with the Healthy Start food vouchers. So they've now added in tinned fruit, So any type of fruit, so long as it's tinned in fruit juice or water, so not in the syrups, of course. So it needs to be any type of tinned fruit, but also tinned vegetables, which then starts to expand the range of fruit and veg that families can buy, because one of the challenges before around fruit and vegetables was sometimes about fresh fruit and vegetables go off and people aren't always so confident about preparing them. And the challenge about frozen was that actually, if we think about some families, particularly who are living in bed and breakfast accommodation or don't have a lot of kitchen storage facilities, one of the challenges there was about having the freezer space to store any frozen vegetables. So the expansion now, the addition to include all types of tinned fruit and all types of tinned vegetables makes a big difference. It's also included in there all types of pulses as well, whether they're fresh, dried or tinned. So that does include things like baked beans and other tins, as it says there, chickpeas, lentils, all of those types of beans and pulses has been a big change as well. With the voucher allocation, so this is for the food vouchers, each voucher is entitles the family, so that child, to £3.10 free food per week, which is actually, you know, it's not brilliant. The level hasn't increased over the last 10 years, although news, it will increase in April, but it's still an important part. Babies, so in the first year of life, so post-birth up to their first birthday, they can get 2 vouchers per week. So that will be £6.20. So that helps to cover the cost if they are on being formula milk. You know, it doesn't cover the true cost, but it goes some way towards covering some of that cost. So once the families are registered, they get the food vouchers arrive by post every 4 weeks. Okay, so you'll get a number of vouchers. And now the important thing about this is any benefit cap. So it's not limited to 2 children, like with child benefit, it's now limited to 2 children, and it doesn't form any part of the benefit cap. So it's not like if you apply for these vouchers, it means that you lose money elsewhere, which sometimes happens, doesn't it, with different forms of that benefit cap, particularly with the universal credit. A slight thing is that if you register whilst you're pregnant, which hopefully we will try and get far more pregnant women who are eligible to register, you need to re-register post-birth and within 8 weeks, because the baby's not automatically enrolled. This is a slight irritation, because certainly when my children are all grown up now, but I certainly remember post-birth, form filling was my greatest strength, but actually we need to try and encourage that. And the reason why there's this change is that pre-birth, it's the mother that is eligible for the vouchers. Post-birth, it's the baby. So actually the eligibility transfers from one person to another. So this is a requirement to actually register a different person. It can't be automatically transferred. What we've done is just give you sort of an example of how actually, although it's only £3.10 per week for each voucher, actually when you have a number of children, but also if you build it up over the year, actually that can be quite a substantial amount of money that is added into the family household budget. So if we think there, we've done an example of a parent with 3 children. So we've got 2 children aged under 1. So each of those children will get 2 vouchers each, and a 3-year-old daughter. So actually this family can get 5 Healthy Start vouchers per week, which is another £15.50 per week, which they can spend on food. But over the year, that adds up to £806. So it starts to feel like quite a sizable chunk of money there. So part of the scheme is also about vitamins, and what I'm going to do is let Kathy talk through around the vitamins, because it's quite a specialised area.
Thank you. Yeah, the Healthy Start vitamins, as we know, it's part of the Healthy Start scheme, and are free to all pregnant women and new mothers with up to their child's first birthday. And the vitamins include vitamin C, D, and folic acid. and they are also free for children from birth up to 4 years. And the vitamin drops contain vitamin A, C and D. We know healthy vitamins are essential nutrients that the body needs for growth and development. And it is recommended that all pregnant women and breastfeeding women and children over 6 months to 4 years should be taking vitamin supplements. One of the vitamins, vitamin D, is given for the development of the healthy bones and teeth and protect against diseases such as rickets. We know vitamin D comes from some foods, though not many, but main source is sunlight, which acts on exposed skin. And Birmingham doesn't have the right UVB between October and March. So in effect, we are all at risk of a certain amount of vitamin D deficiency. The vouchers are issued every 8 weeks and they can be obtained from health visitors, midwifery services, hospitals, various health centres and a few pharmacies. Obviously, COVID and social distancing, that has had an impact on the uptake. But if we can move to the next slide, please, then as you can see, this is Birmingham's uptake of Healthy Start vitamins since 2014, which is not a great graph to be looking at. Birmingham offer a universal offer, so we offer these healthy vitamins for all people. So the blue line that you see is the non-eligible in terms of Healthy Start. The blue line is the people that are eligible for Healthy Start scheme. So we're not doing very well, but we want to see what's the problem, what can we do. We understand there are a few difficulties with data collection, and we're looking at that, and I'll talk about that on the next slide. But we also want to understand more about, are the public aware of the service? Are health professionals aware of the services? And if they are, why aren't people accessing them? So basically, what can we do? So what we're doing is we're trying to simplify the ordering process. So we're currently finalising a new online service. So this is where sites can order vitamins direct, and also the feedback information will now be electronically provided. So we'll move away from the paper system that we currently have. Once this has all been finalised, and I'm anticipating this is going to be by the middle of next month that this will be rolled out. So obviously I will be communicating that to all the frontline services. We also want to increase the number of distribution sites. So we're looking at all the current sites, how we can improve them, maybe include more pharmacies, maybe include nurseries and other community sites that we've not accessed before. So this is another area that we're looking into. We also want to learn from families and health professionals, how can we improve this system? So we're sort of happy to attend meetings, some of your team meetings, if you want to raise awareness and actually get some feedback from you as to where the difficulties lie so that we can address some of those. So if that's something that you want, my email address is at the end of this presentation. So just email me and we can make those arrangements. And we want to raise the awareness of the scheme. So one of the things we're doing is this webinar, and we want to have future bite-sized sessions. And we want you to tell us what are the topics that you need to know about. What do you want included in these bite-sized sessions? So we've got a bit of work to do, but we want to work with you to know how we can improve the service. So we need the feedback from you as to where those support is needed. So I'll pass back on to Sandra, and we'll probably have some questions for those at the end.
I'm sure we
Okay,
will.
thank you.
Yes, Healthy Start vitamins are always, and I think that's really quite interesting that the eligibility for the vitamins is the same as the food vouchers, but if you look at the uptake, and we'll look at the uptake around the Healthy Start scheme in a minute, is really quite different. So what I want to do is just go through about how we actually claim the Healthy Start vouchers, which are both for the vitamins and the food, but also changes that have happened, but also changes that are going to happen both in April this year and also at some point in the autumn term. And you'll see why there isn't a definite date about that. Okay, so the Healthy Start application is, so if you go to the Healthy Start website and the opening pages look like that, you can complete the form online. It's a slight pain that actually you complete the form online, but you still need to download it and print it because you still need the claimant, the parent usually, to actually sign the form and send off. You can get paper forms if that is easier to do, which you can request through the Healthy Start scheme. Another requirement is that the form needs to be filled in English, which of course is sometimes a challenge where English isn't an applicant's first language and the level. The form is actually really quite simple. It's the paper-based form is 1.5 sides of A4, and it is really about names and addresses and various and eligibility for benefits. It's quite a simple form. As I said, just a reminder that when we're registering through the pregnancy, that actually needs to be registered post-birth. One of the changes that happened last April, which people still maybe aren't 100% certain about, is that the form used to have to be countersigned by a health professional, usually a health visitor or a midwife. The counter signature by health professionals is no longer needed. So if you have any old stock of forms, or if you get the paper-based forms and it's the old stock, it will still have the signature saying about the counter signature from health professionals. You don't need to fill that in, okay? It is literally the applicant fills in what's actually going on. One of the things that is in place at the moment is testing it in quite a small area just to make sure that the system works, is moving to doing a digital application. So that is being tested in some areas of London, and to be really quite careful about how that's actually going. So what they will do is they will the applicant will online application, but then instead of getting these paper vouchers, what they'll do is they'll get a prepaid card, which then will be topped up by the relevant amount every 4 weeks, okay? And then it can be used in any shop that has a card reader, the same as it has before. But what they're doing is just testing that out. What they were looking at doing is that rolling it out sometime this year, so from the autumn onwards. And what they will do is obviously there'll be that process about new people being registered, but also how do we move existing movers on. The rollout is yet to be confirmed. They're talking about doing it by region and also possibly by specific user groups. So that's why I said at some point this year, but it's going to be October, November, December kind of thing. So we still have to look to register people using the paper-based voucher system at the moment, because actually it could be 10, 11 months away before we actually get people in Birmingham that are registered. I just want to talk about where we are in Birmingham in terms of our uptake and also our underclaim, okay? Because the data is collected nationally and is collected on 4 weekly cycles, so we can get the data every 4 weeks. And what we did was a few years ago, when we started to look quite seriously at the Healthy Start food vouchers, so it's different from the vitamin uptake, was we looked to see the uptake of the Healthy Start vouchers and where there was an underclaim. So what we did was map it, as you can see here. So in each of the postcodes, which we then overlaid with wards, that the areas that are red are where we have more than 50 people in that area who are eligible for Healthy Start vouchers, but for whatever reason aren't claiming it. But at the time in the city, we had quite a good uptake. We had an uptake average for the city was 70%. So we were doing really well. You were doing really well signing people up. And we have this ambition to increase it up to 75%, then 80%, then 85%. And actually we reached our first target. We got the uptake up to 75% by targeting various areas, by working with the wider workforce. It wasn't just about health visitors, it was looking through children's centres, nurseries, GPs, lots of the wider workforce. We did make a good improvement and increased it up to about 74–75%. We have still registered more people, but as this slide here shows, is actually we have registered more people. So we've increased the number of people that's registered over the past 2 years by 1,700 people. But actually, we have more people than that are now eligible. So actually, if you look at our uptake of eligibility, it looks like we've got worse. Well, we have got worse. We've got more people who are registered, but we still have more people, even more people that should be registered and actually claiming. So actually, when you look at it all there, that when we went from December 2018, when we had uptake of about 74%, by 2019, and this is pre-pandemic, we'd increased the registration, but we still had more people that are eligible. And then the data for 2020, which of course is when the pandemic is starting to kick in, we have far more people. And then actually, you know, I almost shudder to think about what it's going to be like by the time we get the data for December later this year, because, you know, we haven't seen the full effects of the pandemic kicking in, have we, in terms of the uptake. The thing that is a real worry is actually the shortfall in the Healthy Start voucher claims. Actually, when we look at it, we've gone from a shortfall of 3,400 people. So these are parents who are eligible. So these aren't children. And if you think how many children each parent might possibly have, then actually you can see why it starts to grow and grow and grow. So we've gone from an underclaim of 3,400 people who are not benefiting from the free money, the money that will buy them food. We've gone up to over 8,000 people. And as I said, if we assume that even they just have one child aged under 1 or 2 children aged between 1 and 4, so we've done a very modest thing about 2 vouchers per week for each of those people underclaiming, that you can see that the underclaim across the city starts to be, we've got about £2.5 million that should be in the pockets of some of the most deprived people, the poorest communities in the city, to spend on food to feed their children. And also, you know, that it needs to be spent locally. You can't spend this online. They're paper versions, and even with a card, it won't be eligible for online shopping. So it would be spent in the local shops and actually help the local community, the business community as well. When I said earlier that £3.10 had been the same for about the past decade or so, there is an increase planned for this April. So this is the first increase, as I said, for quite a while. It will go up from £3.10 per voucher to £4.25 per voucher. And so actually you can see now that it will be worth £442 because it's that 2 vouchers for a child aged 0 to 1 and £221 for each family over the year for the 1 to 4-year-olds, which means that if we stick at the same level of underclaim, then actually the underclaim, and that's just that we're just counting 2 vouchers, so 1 child effectively per parent, is actually that underclaim starts to go up to £3.5 million that again should be in the pockets of some of our most deprived families. So part of the reason why we're doing this webinar is to raise the awareness of some of the changes that have happened in terms of removing the requirement for the counter-signature from professionals, the increase in the range of the fruit and vegetables and pulses that can be included, but also just to highlight that big underclaim that we have about that's in our communities. And so actually, you know, is that part of that call for action really is we need to increase the registration. We have over 8,000 people who are eligible and not claiming, and this is likely to increase due to the pandemic. So what we would like to ask is that anyone working with families of young children, can you please ask about Healthy Start vouchers and raise awareness, but also help people to register and claim the food vouchers, but also the vitamin vouchers. By registering for the scheme, they're automatically eligible for both the food vouchers and the vitamin vouchers. So you get the food vouchers every 4 weeks, and every 8 weeks, or every other postal one will also include the vitamin vouchers as well. Now, we've left plenty of time for questions, because we know that when we've done these before that there are lots of questions that come through. So this is where obviously we'll invite Alice and Kathy and to sort of start to answer some of the questions.
Right, thank you. We've just had a couple of questions actually. The first question is from Alan. Can the organisation he works for become a distribution site with a nursery on site? The answer to that is yes. So Alan, what I need you to do is if you can email me, and we'll have a chat about the process to have you signed up to be a distribution site. So that's not a problem. And if anybody knows anywhere, any other organisations where they would feel that they want to be involved, again, just email me and let me know. The process is very simple. And then we have a question from Lucy. Do asylum seekers and those with no recourse to public funds qualify for anything? I'm afraid not, Lucy. They don't qualify for Healthy Start vouchers or vitamins because they're not eligible to claim any benefits. So I'm afraid not in that case. Right, okay. Do we accept vouchers in all shops or just large supermarkets? There is a list of shops that we can send a link. It's on the Healthy Start website. Of all the shops and large supermarkets. So it's a selection of both really. Some of the larger supermarkets such as Lidl, Co-op, Iceland, they're actually adding a top-up amount to the current vouchers, aren't they, Sandra? It's a couple of pound on top of what you can already claim for.
If you want to find areas, if you go on the Healthy Start website, there is a postcode checker. So you can put your postcode in and it will come up with a list of sites nearby that are registered to accept the Healthy Start vouchers. At the moment, with the paper vouchers, retailers have to register to accept them, which is a slight irritation, isn't it? But there is that. Once it moves on to the digital process, then any retailer can have them. They'll just need to have one of those card readers. So again, one of the sort of barriers to usage of the Healthy Start vouchers will be removed with the digital process. But as I said, that, you know, think of that as like towards the end of the year, so we need to put things in place before then. But actually, yes, you can find the list of eligible retailers that have registered to accept the food vouchers on the Healthy Start website.
One of the things that we will be doing is we will be arranging a webinar for retailers as well. Because we want to increase the number of retailers, again, that will offer this service, but actually maybe they're just not aware the service exists. So we'll be doing something very similar to businesses and try and increase the number of retailers that people can go to. We had another question about, can churches be a distribution site? That's an area we haven't thought about. But actually we will consider that and just look at that as perhaps an option and just look into that a little bit more detail. So thank you, Val, for including that. So yeah, that's a possibility. Will the new digital cards be usable for? No, they're not used for online shopping.
No, the default will be that it is for going into shops. There is the possibility by exception is if for whatever particular reason the recipient isn't able to access shops. I presume it's more like in a rural area. If actually you're not able to access the facilities, then they can enable that card. But the default will be that it's not for online shopping, which is why I was saying one of the beauties about the Healthy Start scheme is that the money from the Healthy Start vouchers will tend to be used locally. So it's one of those things that actually not only is it good for the individual about that money coming into their pockets, but actually also helps to boost the local economy, because people tend to shop locally-ish for food, within a certain number of miles. So it will be about boosting our local economy as well as helping families as well.
Yeah, and also says, is there a way for them to be used in the same way as other cards, such as contact payments?
Yeah, so the card will that's what they're testing out at the moment is different different ways with the card, but also about how it gets topped up as well. So they're trialing it with a number of users, I think down in Tower Hamlets, about it all. So actually the other thing as well is about if it's topped up every 4 weeks, is there a way to control the amount of money that comes off? So actually could you say, look, can you just take £3.10 off, or £4.20, or £4.36, or something like that? So actually what they're testing out is how flexible it is to actually use. But the initial feedback from the families that have been involved in the testing says, it's a million times better, literally. It's a million times better, because actually you can it is just that sort of prepayment card. So early indications are really positive. But what they've also done is in Scotland is they have a very similar scheme, but it's called Best Start, and they moved over to a digital and a card payment about a year ago, maybe 18 months ago. So of course they're sort of learning how it was rolled out in Scotland and learning the lessons of that, so the good and the bad kind of thing. So they are hoping to proceed at pace with that. When it will actually get to our region, we're not 100% certain. Like I said, they're looking at the rollout. Do they actually do that by region or by user group, or how? So we have monthly meetings about this where they keep us updated with the progress. As soon as we know, we will let people know.
Excellent, thank you. I've had a request for the email. I've just put it in the chat, my email address, but it's also at the end of the presentation. And Laura, the same as Val. So yes, Laura, we will be looking into churches, looking at that as a possible site. Email, we'll email you. There's an email to say that the presentation to go for social prescribers. Excellent idea. Yeah, that's a really good idea. Thank you. We've got Sustain, which is a blog that again has all the up-to-date information you need about the Healthy Start and some healthy diets and some healthy recipes. It's an excellent site, so please access that. Then there's Bina has asked, how do I register to help the families? Could I have your email address, also have the presentation to share? Yeah, the presentation is going to be sent to everybody who's registered for this webinar. And we'll send you some useful links with that as well. Okay, right, just going through these questions now. Where is the scheme advertised? Is there posters?
No, I think the answer to that is one of the interesting things about the Healthy Start scheme is, in a way, the complete lack of any publicity or advertising about it, and I don't know whether that's partly a factor in the decline of the uptake or something like that. But actually, we did create some posters and some tent cards about it, which we have distributed. And we did some work initially, myself and Andrea Walker-Key and Priscilla Brown, looking with retailers about what sort of information they would need about it. But there isn't really any signage around it. It's almost like that sort of scheme by stealth, but that's partly why we're doing these webinars, to try and increase awareness around this. And so actually it's like one of those things, the more people know about it and they talk about it, the more that hopefully it will happen.
Thank you. Laura, digital template put on a Facebook website. Val, do you have a question? Sorry, I thought, no. Okay. Do health professionals still have to sign the application form?
No.
No, no.
That's quite a quick answer.
Yeah, that was a quick answer. Then there's a question, can people apply if they are not working due to COVID and recently started getting child tax benefit, but will be returning to work once COVID restrictions allow?
Yes, if you're eligible for benefits, you're eligible for Healthy Start. So actually, once you stop being eligible for benefits, then you stop being eligible for Healthy Start. But actually, what you can also do is backdate the claim. So actually, you can backdate the claim. I think they're now saying for up to 6 months because of some of the issues around COVID and processing them. So actually, if you know families that were eligible for them month or 2 months ago, they can still put the form in now, and the claim can be backdated for whenever it was eligible. We have been doing some work with the Department of Work and Pensions as well, because of this eligibility, to try and say that when they're working with families and they're making those initial claims, or their work coaches or their sort of system that they have, is actually getting them also to ask about Healthy Start vouchers and registering them, because that removal about the requirement for a health professional to countersign actually suddenly opens up the possibility that far more people can actually help people to register, because we don't have that pressure on health visitors, health visitors in particular, but health professionals to countersign. So anybody here, so the churches, various organisations, anybody working with families who may be eligible, you can register those people, send that form in, and they can get the vouchers.
Thank you. Now, we've a comment, could midwives not encourage mothers to claim when doing scans? I'm sure some midwives are already doing that, but maybe we could raise the awareness for more people to do that. Food banks to advertise. Yeah, that's a good idea. We are linking in with food banks, so we'll try to be doing more with food banks. Can they use online if shielding or isolating due to COVID?
Well, at the moment, the vouchers are paper vouchers. So I suspect the answer to that is no, because there isn't really a possibility about how you use paper vouchers. When it moves to the digital card, like I said, the default will be no for online, except for exceptions. So I presume that if there are particular health requirements, I mean, hopefully by October, November, when we move to the digital process, I am really hoping that we're not talking about COVID and shielding so much. I really hope so. But if it's for whatever reason somebody isn't able to use online, then they say that the Department of Health is saying that exceptions can be made. How and what, no one knows, because we haven't actually got to that phase yet, but they are thinking about it. Yeah.
There's a comment here, there's a lot of families from the BAME community which might not be aware of the initiative. Do you have any leaflets or awareness for them in other languages?
Some people have done some. We haven't done any particularly within Birmingham, but I know that one of the things on this sort of national meeting that I go to is people talking about doing work on particularly looking at YouTube, and where you can also translate it and actually pooling resources, because I think it's one of those things that actually everybody's kind of been trying to do their own promotion themselves, and actually now, you know, now there is a mechanism. That's one of the good things about the online systems now, isn't it? And all these online meetings like this, there now is a better mechanism for pooling and for ideas as well. So there will be more work around that. But at the moment we don't. But what we have been doing is doing work with various community groups. So some like the Spark Hill Women's Group and various other organisations, so that we can talk to the leaders of those groups, who can then hopefully disseminate it and help support families who particularly where English isn't their first language.
Great. Could they be, that's that. Holy Cross Billesley, how can we promote this? Do you promote, I'm not quite sure what you're asking, Val. Maybe you could email me afterwards about that question.
We have done, Priscilla, who's on the call here today, did do some really good short infographics. I mean, they need slightly updating because now the food has expanded since April. So we did do some really one-side infographics around eligibility and the link to the website. So we can have a look to update those infographics, and then certainly send those out by email for everybody, because we've got your emails from being registered, and then you can use that if you want, and there'll be some key pointers there. But I think a lot of it is about making sure that we have those conversations with people that around Healthy Start vouchers. I mean, word of mouth is a huge benefit, isn't it?
We've just got a health visitor who said that she always encourages parents to apply. She's just taken a call from a mum whose application has been returned because the health professional didn't sign the form. That's unusual.
Because the health visitor didn't sign the form?
Yeah.
Well,
yeah.
Okay. I will... if you contact the Healthy Start unit, and the email address is on the Healthy Start website, if you know the name of the person that is, we need to challenge that. But also, if you contact me and my email address, or if you contact Kathy, because Kathy's email address is on there, we will sort that out with the people who are leading the Healthy Start scheme, because that's wrong. That's out of date. That got changed last April, so there's no excuse for making that mistake.
Yeah. Then has any research been done to assess why some families are not registering or taking up the vouchers?
The main research is lack of knowledge. People also just like filling in a form. You know, we're all like that, aren't we? Like, fill in a form, and it sounds like a really small barrier, but actually, when you're busy and you're struggling, and filling in a form isn't usually top of people's list. So it feels like a faff to get around to filling in a form, and particularly previously, where you had to then get the form countersigned by the health visitor or health professional, is making sure that you actually did go to the baby clinic or whatever to meet someone. So that was a barrier. I think it's also people are thinking about whether there's no point because of the benefit cap, or about 2 children or whatever, or and I think also maybe people mix it up with the vitamins and think, well, I can get the vitamins anyway, and there's pros and cons about having that universal provision. So people think of it as it's just about the vitamins, rather than forgetting that there's also this food element, the money element for food. So I think it's been a mixture of those, and they're the main reasons there.
There's a couple of comments about can they have copies of the posters. we will be sending you the Healthy Start website when we send you a copy of the recording, and you will be able to get posters and leaflets and resources from that site. So we'll be sending you that link. Then could an email be sent out to schools? We are working with schools at the moment, again, as part of the Raising the Awareness.
Yeah. I mean, it's always worth doing again. We did send some information out through Primary Forum, because of course, one of the things is that it's not so much the school-age children, because then they're too old. It's about actually, if you're registering a child for free school meals, particularly in reception, it's about if they're younger siblings, it's actually talking to the parents about their younger children. What we've seen nationally is that there seems to be a drop in people using Healthy Start vouchers when the children get to about 2 years old. So actually there's, when we look at the uptake, that there's a higher uptake in those first 0 to 2 years, and then there's a drop off post to, and of course, because for lots of reasons, but that's why we did some work looking at the 2-year-old early education entitlement, because it perfectly matches. If you're entitled to that 2-year-old early education, then you're also entitled to Healthy Start vouchers. So we did some work with Tracy Linton, who leads on the registration of people around that, to say that when they're sending information out, that they could also send, as well as the early education entitlement, that they also sent out information about Healthy Start as well. But it's always worth doing again. So yep, we will certainly do that again. Yep.
I'm conscious we've got quite a few questions, so I think what I might do, because I know people will possibly have to go soon, I will put all these onto a frequently asked questions, where all these points have been will be answered, and we'll send that out to everybody again as part of the follow-up email. So I think if we stop that for the moment and maybe go on to the next slide for the millimeter, just a couple of questions. So Prue, have you got access to that? Priscilla?
Yes, I do. Kathy, sorry for the delay. Just unmute. Yeah, so I'm ready.
Okay. There's just a couple of questions. We'd be really grateful if you could just answer those for us, just to sort of give us a quick view of what people want and what they want for the future. So are you able to put that up now, Priscilla?
Can you see my screen?
Yep. So would you like to take us through the process?
Okay, then. So has everybody downloaded the app or opened it on their phone at all to the Minimeter?
Yep. Okay. So if you have, what we want you to do is, what percentage of today's information was new to you? So if you could just pop in your answer. That's quite interesting that there's 100% and 25%. I'm assuming maybe some people haven't downloaded the app. So, okay. Give that another minute. Oh, they're flying through now. Okay. Should we go on to the next question? Right. This is something we really would be interested to know. What are the barriers in asking a woman if she is eligible for Healthy Start vouchers? Now, if you haven't got the app to be able to do this, the Metameter app, it would be really sort of useful for us to include this as part of your feedback questionnaire and give us some ideas of your experience of where you think perhaps some of the barriers lie that maybe we're just not aware of. Language, yeah. Knowledge, definitely. Knowledge of benefit, entitlement, yeah. Yeah. Stigma, yeah. That would possibly be a big one. Yeah. Again, it's a difficult conversation. Yeah. Okay. Should we go on to the next question, please, Priscilla? And then this is useful for us. What topics would you like us to include in future bite-sized seminars? So what areas do you think people need more information about? We will be looking at health professionals, but we'll also be looking, as I say, retailers and also the general public, so pregnant women. So we'll be accessing all those areas. Right. Yeah, yeah, that's a good point. If there's no printer. Dental provision. Okay, right. If we could move on to the next slide, then we will take these up, and as I say, we will look through these.
That's the end of those slides.
That's the end. Right. So what I'm going to do is wrap it up now. I want to thank you all for the questions and comments, and I'm sorry we couldn't get through them all, but I'm aware people will possibly be starting to leave now. And we will be taking away some of the suggestions that you've made to help improve the service. I want to thank Sandra for a very informative presentation. Thank you very much. But I also want to thank Alice and Priscilla, who have worked very hard in the background, organising and supporting today's webinar. So thank you all. We really would value your feedback from today's webinar, and as I say, a follow-up email will be sent to you. So it'll include the recording of today, some useful links, and there'll be a link to provide us with some feedback, and we really do need to hear what your thoughts are. So please just take a few moments to complete that. Thank you very much for joining us, and I hope you enjoy the rest of your day. So take care. Thank you. Nice big thumbs up.